Welcome back to 17 on 10. Joining me this morning is Dr. Anabiet Udofia from Adventist Health, here to talk about arthritis. Good morning. Thanks so much.
Good morning. Thanks for having me.
So this is Arthritis Month. May is. Let's first talk about what arthritis is.
So arthritis, when you think about the most basic definition, is going to be inflammation in the joints. The most common types of arthritis are osteoarthritis and rheumatoid arthritis, but there's actually over 100 different types of arthritis.
And I know that this is something that is very common for a lot of people, but I think some people are always shocked to find out that there are different types of arthritis that you can have in different parts of your body, correct?
Exactly, correct.
So what are some of the things that people should look out for if they could be at risk for developing arthritis?
So the most common signs and symptoms of arthritis is really going to affect your joints. And when you think about that, because there's so many different types, the symptoms that people can have may vary. But the most common things people will see are pain in the joints, swelling, redness, stiffness, and decreased motion in the joint affected.
Now, is this something that is inevitable for some people, or are there some things that you can do early on to prevent developing arthritis?
Yes, so some people do have risk factors for arthritis. One of the biggest ones that we can't really control is our family history. So if you have a family history where your siblings or your parents have had arthritis, then it's more likely that you will develop it. So you really need to pay attention if you have a sibling or a parent who needed a joint replacement before the age of 50.
Okay, I know that a lot of people have, every once in a while, they'll go through periods of times where, you know, their joints are sore and stiff, or they may be complaining about some pains. Is arthritis something that is more common than not, or do you think a lot of people just kind of assume that they have arthritis and it really isn't?
So arthritis is actually very common. When you look at America, it affects over 50 million people.
Okay.
So more likely than not, they are experiencing arthritis. I think, though, that a lot of people don't really know all of the different strategies they can use to manage it, and know that they don't have to really live with that stiffness, that achiness. And there's basic things they can do, incorporating exercise in their diet, supplements that support cartilage health, maintaining a healthy weight. All of those things can help decrease those symptoms.
And I know that arthritis can affect you at any stage in life. What are some things that people need to do if they are starting to notice some of those symptoms?
So the first thing would be to schedule an appointment with your primary care. Talk to them about your symptoms, because we may assume that it's osteoarthritis, which is the most common type, but there's rheumatoid arthritis, there's psoriatic arthritis, there's gout. So you really want to make sure that you understand the type of arthritis you have, so you can tailor your treatment program specifically to that type of arthritis.
All right, Dr. Udofia from Adventist Health, thanks so much for coming in.
Thank you.
It's so important for all of us to know. All right, we're back after this.